Top in hand, Teresa Toll makes her way to exam room 9. Her schedule calls for a full day of patients.
Hi, good morning. How are you today?
She's now a clinical care technician for Bon Secours Mercy Health, but that wasn't always the plan. Enlisting in the Navy in her 20s and climbing through the ranks, she became a corpsman, providing medical help for other sailors.
On the ships, when you have someone that's dehydrated, the doc will have you to go ahead and start IVs, or someone has a minor cut, you'll go ahead and do a couple of sutures.
But after 26 years of training and giving medical treatment, she says none of it seemed to matter when she retired and entered the civilian world.
It feels like you're almost starting over. In the military, I mean, we did a little bit of everything, but once you get out, you're really not qualified to do anything because the credentialing, it doesn't carry over.
Toll, like so many other military members, find themselves in this position.
It can be pretty frustrating and scary as well. You're not sure what you're going to be able to do, if you're going to be able to use those skills, or you're going to have a job waiting for you when you get out.
To temper the transition, the Virginia Department of Veterans Services created the Military Medics and Corpsmen program in 2018. Even without the required civilian healthcare credentials, veterans are hired to put their skills to use.
No other state has this type of program. They can jump right in and pretty much function at the level of, an LPN, RN almost.
As they work in local facilities, veterans also go to school to gain the healthcare accreditation that they're missing. The MMAC program acting as a stepping stone.
The transition from military life to the civilian, life sector can be pretty hard and scary at the same time. But this program allows people to kind of transition flawlessly.
Since the program started in Virginia in 2018, Ramirez estimates that they've hired more than 60 veterans from all branches. There are, however, still some gaps in the system. Toll says that finding opportunities like the MMAC program isn't always easy.
There are programs out there, but they're just not advertised enough or put out there enough for people to know that they're there.
Toll says the best way to overcome this is by being proactive, having a plan, and just asking questions. She says it's also a good idea to reach out to the Virginia Department of Veterans Services before you retire.
We've helped a lot of people, and I hope we can continue to do that.
Because like Toll, when your service is done, it's time for the MMAC to serve you. In Suffolk, Erin Miller, News 3.